breast cancer, early signs and symptoms, and breast self-exams. Breast cancer is currently the most common cancer globally, accounting for 12.5% of all new annual cancer cases worldwide. In 2020, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. Breast cancer tumors develop when breast cells mutate and grow. The most common kinds of breast cancer are invasive ductal carcinoma, invasive lobular carcinoma. Breast cancer develops for several years without any signs or symptoms. Symptoms appear when a tumor in the breast is large enough to feel a lump or when cancer has spread to nearby tissues and organs. The main objective of this presentation is to help women to recognize the early signs of breast cancer so that they can detect the disease at a very early stage, even before the cancer stage. Survival improves when breast cancer is detected early. Survival rate depends on many different factors, especially the stage of cancer. Early signs and symptoms of breast cancer. A breast lump is a localized swelling, protuberance, bulge, or bump in the breast that feels different from the breast tissue around it or the breast tissue in the same area of the other breast. An underarm lump can be a warning sign of breast cancer. This mass is caused by the enlargement of one or more of the lymph nodes in the armpit, which play important roles in the immune system. During menstruation, the breast undergoes several changes, so noticing these changes during this stage is normal, but the presence of these changes outside menstruation is worrying and a medical consultation is required. A change in the skin around the breast may be one of the first signs of breast cancer. Signs such as sudden dry skin, itching, redness, scaling or thickening of the skin can be warning signs. Changes at the level of the nipple may be associated with the emergence and development of breast cancer, such as redness, the appearance of a rash and swelling or with a feeling of heat. In some cases of breast cancer, nipple skin peeling and the top layer of skin falling off in the form of flakes are accompanied by other breast symptoms. Secretions can occur from the nipple of both breasts or only from one of them and are often accompanied by pain and spontaneous or after pressure on the nipple. A greenish, brown, or red discharge that is accompanied by pain and a burning sensation with nipple retraction can indicate breast cancer. Theoretically, breast cancer is not painful except in very rare cases of inflammatory cancers. Breast cancer can cause significant changes that sometimes lead to pain, tension, itching, discomfort, and a burning sensation in the chest. Symptoms of advanced breast cancer. When breast cancer is widespread and in the absence of treatment, cancer cells invade the breast gradually, and then migrate, through the lymphatic circulation, to the lymph nodes as well as to the circulatory system to settle and multiply in other organs of the body, especially in the liver, lungs, bones, brain, etc. In addition to the symptoms at the level of the breast, other symptoms appear at the level of several organs. Bone pain. Lose weight. Nausea and loss of appetite. Shortness of breath, coughing, and fluid buildup around the lung. Headache. Diplopia. Muscle weakness. Jaundice. Breast self-exams. Breast self-exam, or regularly examining your breasts on your own, can be an important way to find a breast cancer early, when it's more likely to be treated successfully. Monthly breast self-exams can help you detect changes that may be signs breast cancer. Step 1. Examine your breasts in a mirror with hands on hips. Step 2. Raise arms and examine your breasts. Step 3. look for signs of breast fluid. Step 4. Feel for breast lumps while lying down. Check under the armpit, swollen lymph nodes. This presentation to breast cancer signs and symptoms can help you figure out whether it is time to see a doctor, but, in the event that you discover the appearance of unusual signs or symptoms, especially among those that may be linked to breast cancer, you should consult a doctor to carry out further examinations. Diagnosing breast cancer: breast exam, mammogram, breast ultrasound, removing a sample of breast cells for testing, biopsy, breast magnetic resonance imaging, MRI, etc.